Renee Crosh with you on Mornings. Let's talk about modifying your home, adapting your home perhaps after you've had some kind of surgery. You may have even had something more severe like brain injury where you've sustained a permanent physical impairment. What help, what support is out there for you to do that? Emeritus Professor Catherine Bridge is from University of New South Wales, and she is one of the foremost experts in this field, and she joins us now on Mornings to share her knowledge and expertise. Hello, Catherine.
Oh, hello, Renee. So fantastic to talk to you about something I care about today.
Well, we all care because nobody wants to stay in hospital for longer than they need to, and often if you've had something like a knee replacement surgery or a hip replacement surgery, that is temporary, and after some months you may return to, full capabilities. But what if you've had a permanent physical impairment after, say, a brain injury? Who helps you modify or adapt your home so that you're able to get back into it?
That's a great question, and at the moment I guess it's limited to mostly allied health professionals, but unfortunately I guess you have to be able to access them, and there is a shortage of that. Or the alternative is you go to Bunnings and you do it yourself, and in fact we have done some research and we have shown that people are in fact resorting to doing that with some good outcomes and some not so good outcomes.
Who foots the bill?
Well, at the moment it's pretty much to do with self-funding because although both the National Disability Insurance Scheme and aged care have some money that you can apply for, that money is limited, and it depends on your ability to access an occupational therapist and to have an assessment. So, and that can be problematic because we've got a massive shortage of occupational therapists in Australia, and in a land as vast as Australia with a population as urbanised as Australia, it's unsurprising our health, aged care and disability workforce is stretched so thinly, and that of course is particularly acute in rural and regional areas where accessing GPs and allied health is almost impossible.
Presumably, Catherine Bridge, a lot of modifications would have to be made in the home to enable somebody to come back in such a state. So, presumably, if you've had a knee replacement surgery, for example, walking up a lot of stairs is going to be very difficult.
Oh, absolutely. And there are, I guess, three ways that people can deal with that. But I think the issue is after surgery, it's way too late. So you actually have to have had an assessment in a reasonable time frame well before the surgery is proposed. Because if you need to make structural changes to the home, such as installing a lift or a grab rail to assist you to go home post-surgery, that obviously requires a builder, and you have to purchase the assistive technology and have it installed, and that can't be done really in less than 6 weeks to 8 weeks, assuming that everything's working well.
What's the alternative if you can't adapt your home in time, or you can't afford the costs to modify your home? When you're talking about putting a lift in, I mean, that's going to have to be thousands and thousands of dollars. Yeah. What's the alternative?
Yes, a very good point. So, I mean, the issue, I guess, in terms of short-term stuff is that you can temporarily relocate to a hotel or to another family member's place, or you can move a bedroom downstairs. You can hire short-term equipment. But with chronic health and significant health problems with an ageing population and with growing disability, osteoarthritis, for instance, which can't always be easily fixed with things like surgery, you need to think of much more long-term solutions. And those long-term solutions do require those structural changes.
Gee, it's a big issue, isn't it? We do have an ageing population. We do know this. On the text line, Catherine's saying you need to adapt your home earlier, before before things happen to you. You have to remove all unnecessary furniture. You have to make sure you don't have loose rugs and loose cables around your home. Most falls occur in the home, and clutter is often the biggest culprit leading to hospitalisation. It's a good point Catherine raises.
Yes. And I think there's a couple of other issues. So, I mean, the National Skills Commission identified a massive shortfall of allied health and particularly occupational therapists in every state and territory. And basically, we need to be looking at alternative models of assessing and helping people to do this. But the technology and the current assessments are not very effective, either for assessment or for streamlining the travel, the documentation, which helps people make good decisions in a timely way.
So, Catherine Bridge, in a best possible case scenario, somebody goes in for surgery, and at the end of the surgery, when they're wanting to leave the hospital to return home, does an occupational health professional help them or tell them what needs to be adapted? So you've got to put, say, a handrail in. You've got to adapt your shower so that you can shower with a chair or something that's modified so that you're able to use it. Is that what happens?
Traditionally, that is what would have happened, and that would have been part of standard discharge planning. However, I guess that's been disrupted with the change in the cost of hospital and in shorter stays. So the idea, I guess, is to get people out iller and sicker as quickly as possible, because that reduces the cost on the healthcare system, but it also reduces the risk of infection, which, as we're probably aware, hospitals can be problematic for. So, and I guess healthcare has also had a number of funding shortfalls, which has meant that the number of occupational therapists employed directly in healthcare to provide those discharge services has also fundamentally been reduced.
On the text line, Judy says, after my knee replacement, after rehab, which was terrific, I treated my stairs as part of my continuing rehabilitation. I particularly asked to be taught how to walk up the stairs and how to get up and down them, how to get up off the floor all by myself. That was a really important part of my rehab. You're raising this issue, Catherine Bridge. What do you want? What do you want to change?
Well, I'd like to see greater attention from government in preventative things that reduce wait times, that provide care when needed, that minimise hospital stays, reduce readmittance and reduce health cost. And one way we could do that is to really develop some new technology and to get some good evidence around that. We've been playing with telehealth, but we haven't really leveraged how we can do that for things like home modification, because home modification is complex. It requires spatial analysis of the home. It requires consideration of someone's height, weight, and activity preferences. Not everyone toilets in the same way. And of course, houses are also quite unique depending on how old they are, how people have customised them. And you also have to remember that a house needs to be a welcoming place. So there's not anyone I've met that says, I would like my home to look like a hospital. So it also has to be attractive. We have to have assistive technology, which people can buy at Bunnings, which is going to improve their home and make it more welcoming and more attractive, not make it look like a nursing home. Finding people who are able to do what they often consider to be small or little jobs, which can in fact be quite complex and fiddly, is also an issue. As is training. So, I mean, one of the issues for allied health and occupational therapists is that, apart from workforce shortages, there is often lack of accreditation and specialisation around areas like this, and there's an inadequate availability of senior and experienced people and an oversupply of part-time and casual workers or new graduates who really don't know what they're doing and can, in fact, cause more harm. One of the reasons that we need to be thinking about the barriers to this, and denial is a well-known one, is that we need support from other people. We need support like tax incentives. We need and we need better products. We need to be producing things that are attractive and desirable that we